I want to say here is that I think, in fact, it is wrong to allow economic pressures on these issues to determine the questions. And I come from a society which has full medical insurance for every citizen, and I certainly support the idea that in this country too, every citizen should have full national insurance, full healthcare insurance, which would not be subject to their ability to pay and would not be based on whether they are extremely poor. So I accept that there are problems in introducing policies in societies that do not provide adequate coverage, and I certainly think that that coverage ought to be provided. But I think that this is still a situation in which individuals can make decisions. They should be given full support for whichever decision they make, so that parents who decide that they want their disabled child to live should be given full support to have the treatment that that child needs to live and to have the long-term care that that child will need to have to live the best possible life within the community that that child can live. So I don't think that it should be economic stress or economic burdens. That I agree it doesn't happen, and I think that it's wrong that it doesn't happen. If you'd only stay in the room and we could discuss this, you would find that we perhaps have a lot to agree with in terms of the economic support of the state for people with disabilities, which I totally agree is inadequate. But I don't think that that deals with the question of who should make these decisions, and as I say, it comes back to me that either the individuals themselves or the parents of those children are the ones generally in the best position to reach those decisions.
I understand you're trying to anchor this in family and democracy, but as you can hear by the din, and as certainly you have remarked upon yourself, there's a great sense of inequality. We don't live under a despotic regime, but we do live under a regime that is, or an administration, I should say, that is not fair in terms of equity.
Well, that's a fair point, and I think, you know, if one is to say that this kind of legislation that I'm proposing is desirable in countries that have a national health insurance scheme, which essentially every developed industrialized country except the United States does have, then, you know, I think that's a perfectly reasonable point to make. And you could say that until the United States gets that, perhaps it's not ready for it. I think that's a reasonable argument, but it's not the kind of ringing defence of human dignity that Dr. Cameron was making before. It's a rather odd kind of claim for him to make, given the kind of rhetoric that he started out with.
Dr. Cameron.